Hello there, my name is April Lynch, and I'm a vocational rehabilitation counselor at Virginia Commonwealth University Rehabilitation Research and Training Center. Today, we will be talking about mental health tips for employer practices. So with current events in 2020 and 2021, we can take an assessment and a look at the big picture of what's going on in our country and notice that there has been an increase in prevalence in mental health conditions. If we want to look at some specific statistics, then we can recognize that depression specifically has increased since March 2020. And in September 2020, 8 out of 10 people that went through an anxiety screening ended up meeting the criteria for moderate to severe anxiety. So clearly, mental health is a priority. If we want to think about this in the workplace and how we can make a difference with starting there and then allowing that to expand out within our community and through the employees that we foster each day, then we want to think about being proactive about mental health and not just reactive. So when employers are considering best practices or implementation of any sort of support for mental health within the workplace, how can we identify some strategies and approaches for your company that will allow you to feel like you are getting ahead of it and being proactive to serve and support your employees and their mental health? If we're being reactive in this approach, then that could look like when a person identifies that they're struggling at work and they've already, been burnt out, and you're noticing that there is a decrease in productivity, maybe more absenteeism. And so if we're beginning to act once those things have already started to occur, then that is more of a reactive approach and trying to work through it once there's already been some setbacks and barriers that have occurred. So today we're going to talk more about how we can be proactive in the workplace as employers to best support your employees and make mental health a priority. And one of those ways that we can start to assess and really consider where are the different areas in the workplace that need some improvement for mental health practices. We can take a look at what we call the 8 dimensions of wellness. So when we're taking a breakdown of the 8 dimensions of wellness, these different categories are the physical, emotional, financial, intellectual, occupational, environmental, social, and spiritual wellness of an individual. And this makes up their overall functioning in their daily life. So if we can take an approach of considering all of these dimensions in the workplace, then we might be able to find a balance and then implement some proactive strategies to then help the employees feel like they're being supported in their mental health, and then they will be demonstrated in the progress that we measure over time. So some of these areas may stick out and you think, oh, well, I don't know if I really want to focus on that in the workplace. Spiritual wellness, that category may stick out and have a person automatically think religion. Well, how can we also take a bigger look at what spirituality wellness may represent for a person? It may be the ethics of an individual or their values. So as a company that would like to contribute to a community and also fostering the wellness of their employees, we could dive deeper into that spiritual aspect by recognizing what our mission is as a company, what are your ethics, and what are your values, and how does that relate with the people that you employ and are in the workplace each day. All of the other dimensions, you can continue to use different strategies to assess these areas to see where there might be able to be some improvement, where things are going well. For example, physical wellness, you may have access to gym memberships through your company, or there may be some sort of resources you provide if a 5K is going on in the community, or if there's just different wellness programs for physical exercise or movement. So how can you take a look at each dimension of wellness and identify where the needs are in the company. And again, where things are going well and give yourself some credit, but also recognize where you could take it further to fully support those employees. So continuing to think on the rest of these categories, like emotional wellness, how much are you identifying when your employees need to manage stress and their overall emotional regulation? If there's any sort of setbacks there, maybe a proactive strategy is pointing them in the right direction for an employee assistance program, or offering the idea of experiencing professional counseling. So just really checking in with your employees based on which level of dimension you're considering might be affected in their life. And we know that obviously all of these approaches are going to fall in that occupational, because that's what we ultimately want to grow, the company and the focus of best practices for mental health within your business. So if we could take those career goals and that career development that fall within that occupational dimension and think outside of the box of how we can measure that criteria in the other dimensions, then we might be able to find a balance in all dimensions of wellness, which in the end is going to contribute to proactive strategies within your company. So if we take a look at some more recent statistics, these numbers have consistently been high in our country, but if we want to take a look at more recent data, we can really identify that in order for an individual to thrive and not only survive, their needs need to be met. And that may fall within the area of healthcare, health insurance, allowing them to access different benefits for their mental health conditions if those are existing, or identifying if they're starting to develop something based on recent events or life adjustments that they may be going through. So if we want to take a look at the numbers here, looking specifically at Virginia, we have 147,000 individuals that are uninsured at this time. And 13.5% of those individuals have a mental illness. 57% of adults with a mental health condition are not receiving treatment. And this includes just talk therapy or going to a counselor. So those treatments are not happening for 57% of our country. And then this points out that 5.1 million people with mental health conditions are uninsured. So maybe starting with what benefits are being provided in your company and what sort of resources are already existing. And we're going to continue to talk about this, but just to put these numbers out there and really give a representation of our state. And if you're tuning in from another state, then please feel free to log into the mental health care data to take a look at your specific state. So some of the risks if we don't pay attention to mental health in the workplace. This can lead to absenteeism. So high rates of employees being absent because they may feel as if they need a mental health day, but maybe they don't feel comfortable advocating for that or disclosing to their employer that it's not just, a sick day, but they may be going through bigger adjustments with their mental health. This may lead to high turnover then. So if individuals don't feel supported, then they may leave the position. And also this could lead to low production rates. And if we have low productivity of our employees, then, that might point out that they're burning out, or also leading to the potential that we may not value that employee anymore. And it may not be their skill set, right? So the hard skills or the soft skills that individual is bringing to the workplace, they've just been affected. They have had a little bit of a change based on adjustments in their life and their mental health condition. And we want to take a look at that and how we can provide support and foster the barriers and promote strengths within the individual so we can avoid these risks of not practicing mental health within a work culture. Other areas that could be risk factors lead to that poor communication amongst employees and management. We know that communicating between employees and management fosters an open line of communication in the workplace, which leads to self-disclosure and advocacy. If there is poor communication in the workplace, then employees are likely to not disclose, and it may lead to some of those other areas that we discussed, like absenteeism, low production rates, and overall burnout. And then just the big picture here, we can imagine that lack of cohesion and motivation will exist amongst employees if they do not feel supported in their mental health, or even if employees that aren't dealing with mental health issues, if they observe that their coworkers who do have mental health conditions aren't being supported, this could also lead to dissatisfaction and distrust in a company. And overall, we want our employees to feel autonomous. They need to have choice and, feel as if they are in control of their decisions, of course, based on policies within the company and their job description. But everyone has a right to feel autonomy. And if we can recognize how we can provide choice, informed choice, then we can have our employees promote a better mental health culture within. So after talking about some of those risks, we want to switch gears now and really talk about how we can walk the walk and talk the talk. Well, that starts with the leadership, right? Let's go all the way to the top and think about how are our leadership in implementing practices to support mental health in the workplace. And this may not be for every employer, but some may benefit from having a little self-disclosure on their end, opening up to their employees or their colleagues about a mental health condition they're going through, or maybe something that they have experienced in their family. And this can create commonality, build trust. Self-disclosure is a modeling effect for employees to be able to do that too. So if an employer or a leader feels comfortable opening up about their own mental health conditions or just their experiences, this can help shift that experience within the workplace for those employees. Also, if we can create mental health opportunities in the workplace, this can foster that relationship of trust and cohesion as well. That starts with really setting that inclusive climate, but also providing a supportive tone on leadership end. So whether that is sending out surveys to assess your employees' engagement and satisfaction, or that's setting up a diversity and inclusion committee, or it's connecting with outside agencies like a private practice, with a counselor who may provide disability training, or an employment organization that may provide disability training and job site training. So how can we, make some connections with outside agencies, or even start within and gain the ideas from our own employees of how we can create mental health opportunities in the workplace and create that sense of belonging and community that then fosters the individual identity of each person. So overall, our goal is, when walking the walk and talking the talk, to create that company cohesion, but remember to foster the individual needs of all of your employees. So if we're thinking, big umbrella term, okay, we're going to focus on mental health. Well, remember, there's a lot that falls under mental health. It's not just depression or anxiety. There are many mental health conditions that exist out there that individuals are experiencing from birth or, acquire later in life. So how can we really identify the needs of each individual by starting at the top with the way we practice leadership implementation and disclosure? So a category of different techniques that may be useful within the workplace could be motivational interviewing. So if we think about partnering with those outside agencies, whether that is connecting with a local psychologist, or finding a licensed therapist or a licensed social worker in the area that experiences different services that allow them to provide motivational interviewing techniques. This might be something that could be transferred into the workplace to help leaders connect with their employees and really understand what are the overall needs of their employees. So if we think about motivational interviewing, we really think about the spirit and the tone that this person is setting to evoke motivation and meaning from their employees. So imagine yourself as an employer sitting in your office with an employee, or maybe a few of your employee leads on a team, or whatever your setup might be, and you're talking with them about what type of change they would like to see in the department. Really listening for those words of, I need this, I desire this, I want to see this, I hope for this. Let's evoke that motivation and meaning, and listen to what this individual is hoping for the company and that overall mental health culture. And if we pay attention to that change talk, which is what we call in motivational interviewing, as someone exhibiting the desire for behavior change that is going to help us lead towards the big picture change in the company, we can really identify the different areas of competencies that we can provide to our employees to promote confidence. And that may be being competent and knowing how to access an employee assistant program. It may be feeling more competent in the work tasks they're doing, or even more competent in talking about the mission that the company that they work for has, and how that relates and aligns with their values. This can lead to an increase in self-esteem and boost overall morale in the company. So thinking of motivational interviewing as a technique that you could utilize in the workplace to, again, evoke that motivation, identify the meaning, but then taking it further and helping your employees and you as the employer envision what is that positive change going to look like. Okay, so we've talked about some ideas, we've heard what we want, we've heard what we need, we've heard what we desire. So how are we going to do that? Well, let's envision it. So just like you would imagine what any goal might look like, what steps that takes, what is the planning process? At this part, we can definitely use the motivational interviewing technique as well of the engaging, focusing, evoking, and planning. So we're going to engage our employees and we're going to identify what their motivations are and what the meaning is for making this change. We're going to create some focus on what those competencies are and how we're going to create that confidence building within our company, that mental health culture is in existence, or at least beginning to be shaped. And from that will continue to evoke that envisioning and the thought process of what that positive change can look like and the overall importance and meaning of it for the company. And that leads to taking action and planning. And so when we're in the planning phase, if we want to identify another 4 areas of MI, we can consider, what are our partnerships looking like? Not only what are our partnerships looking like with our employees, but how does it look within human resources? How does it look, leadership to leadership, leadership to human resources to employees? We need to take a look at all the partnerships existing within our company, and then also take a look at the external partnerships. So as I mentioned earlier, whether you're connecting with an employment organization that can provide job coaching services to employees that have disabilities, or even you might have an individual come in to provide some disability awareness and mental health training. So, just identifying where those partnerships could be made and to better foster that mental health within the workplace. And then taking an eye at the other 3 areas of MI for this particular approach, with, again, just evoking what the needs are after identifying those partnerships. So really, what can we evoke motivation and meaning wise to get the most out of each partnership to promote mental health? And then how can we maintain acceptance in the workplace, which connects with that self-disclosure piece and individuals feeling comfortable to self-advocate and, just come to their manager to talk about how they feel and what's going on in their life and how it may be affecting their work. And then when those conversations happen, how can leaders, kind of take a minute and recognize empathy and compassion being put into that conversation will allow you to evoke more from your employee. And that will in turn allow you to give back to the employee more to prevent some of those risks that we've talked about before, like the turnover rate, absenteeism, or low production rates, as well as burnout. So motivational interviewing can be a great technique to promote behavior change across many environments. And, looking for a specific trainer in this area, again, it may be, looking out in your community for a local psychologist that has experience in this area, or a local counselor, and really making that connection of how you, again, can engage your employees, find the focus, evoke the change, and then plan to take that action. So all of this falls in the power of the company. So the power of the company is the employees, and the way that we can gauge current satisfaction within the workplace, but then also the desire for change or individualized needs that need to be identified. We can identify that through surveys. So if we send out employee surveys, this also promotes the overall perception of, again, what their needs are and how leadership can foster that. So this, may be something that you work with your human resources team on, and talk about how this can connect with each employee, and it can be an anonymous survey too, but really just something that you might want to talk with your human resources department about to gain that overall perception within your company. And I've touched a few times on the employee assistance program, but this really is an excellent resource for employees to be directed to, so they can hear what their options are, they can hear what benefits are provided, and this often can lead to counseling sessions dependent on what insurance that person may hold. They may be eligible for free counseling sessions. So it could be anywhere from, like 4 to 6 free sessions initially. So always something to look into. And there are other resources as well, like group opportunities or just different community engagement that may be motivating to your employees and give them that outlet to overall increase their positive mental health, but their productivity in the workplace as well. And with diversity and inclusion committees, this is, starting within and really allowing your employees to come together. This could be a voluntary experience where individuals really feel passionate about diversity and inclusion, and how we can bring those passionate, motivated individuals together to identify those needs. Maybe at this point, surveys have gone out and they're assessing the surveys, or maybe this committee is who is going to help create the surveys with human resources. So just something to consider. If you don't already have a diversity and inclusion committee within your company, how can you take the steps to build that? And if you check out one of our other webcasts about how to be an influencer for hiring individuals with disabilities, part 1 and 2, we go over a little bit more in depth about what it could look like to create a diversity and inclusion committee. But this definitely connects with overall mental health culture and where we can be getting that information to make that change. So with workplace support, especially during life adjustments, we know that there has been major adjustments happening around us, and people may be experiencing significant loss. The parents may be, dealing with having their children home out of childcare, or maybe they're a brand new parent and they're going to be going on maternity leave or paternity leave, or whatever the situation may be. So also there could be work injuries, and this could be a transition. During this time, if leadership can promote flexibility and compassion and empathy, then we can evoke those needs of the employees and then really understand and identify where we can put those proactive strategies in place to help them. And then overall, professional learning opportunities, not only just for leadership, but for employees as well. How can everybody in the company grow and experience different learning opportunities to contribute to their professional development, but also their personal development? And this may be, company to company learning management systems, or accessing, different trainings from nonprofit organizations. There's lots of virtual opportunities out there to learn about mental health right now and to help our employees feel empowered to self-advocate. So if we can really recognize that the power in the company falls within our employees, that can help us get back to the beginning of the process that starts with focusing on being proactive and identifying opportunities within our company that will promote mental health in the workplace and foster that support for individualized needs for each employee. And overall, if we want to think about how is this all going to pan out, how do we keep it going? Programs can start, but how do we maintain? How do we progress? We have to measure, right? So making things specific. How can we make it a specific goal? How can we measure it? And, how are we going to attain this? How is this going to be realistic for our company? How are we going to make this time sensitive so we make sure that we're reaching these goals as we go along? So I basically just broke down the SMART acronym. So specific, measurable, achievable or attainable, realistic, or time sensitive. And so if we think about SMART goals within companies, that can connect too with how we form a mental health culture and overall, resource program, assistance, whatever might be your focus with how you want to grow the mental health culture in your company. But if we can measure our progress and grow from that, then we can continue to maintain. So some of the areas that you can focus on for tracking progress would be through those employee engagement surveys or overall satisfaction. This may be satisfaction within their position, satisfaction with connections with management, just the overall flow of the workplace. Again, this would be something to partner with your human resources team on, or if you have or are developing a diversity and inclusion committee, how can you make those connections to help track that progress? Monitor those risk factors. So if we see that absenteeism is going up and turnover rates are going up, well, where are some changes that we can make within the company? And again, the power of the company is with the employees. So let's check in with them and see where we can, talk about where regression might have occurred and where we can improve that. And hopefully this will then lead to that employee productivity, but we want to continue to monitor that as well. And, just notice trends there and track progress with productivity going up, and, maybe connect that with, when were programs conducted or when were trainings being implemented, and really be able to measure and grow those results. Also, maybe on the human resources side, taking a more analytical approach with healthcare and the disability costs, really just identifying what the company is putting out and, where that's coming back to the company in their employee rates and their productivity. I think within certain research, there's been different trends about, companies putting money into their healthcare and their disability costs, and then that allows them to then grow their productivity within their company. So if we can continue to analyze those trends, we can see where we're doing well and where there could be some improvement. And overall, really checking in with that company mission and connecting it with our community. We know that altruism is everything right now, and promoting that within our companies can promote the mental health culture and overall positive mental health within our employees. So checking in with your company's mission and identifying where it's matching what your employees' needs are and what they are advocating for, and maybe where we might want to expand it. And missions can always change and always be elaborated, right? Change can be good and it can be difficult at the same time, but if we have leadership that's willing to track the progress and potential regression at times, then we can make that change. And it starts within the company, with the employees, and with leadership listening and walking the walk and talking the talk. So overall, just finding ways to measure your progress and growing that mental health culture. And so this leads us to our resources page. If you want to access our site, please feel free to. And as I mentioned earlier, we have other webinars that relate with this topic as well. So feel free to visit our site and check those out. I appreciate your time today, and I hope that you enjoy the rest of your day. Thank you so much.